Prader-Willi syndrome case study by Katrina Pinozzo. In this case study, I will be examining a 4-year-old female with Prader-Willi syndrome. She suffers from insatiable appetite, obesity, she has almond-shaped eyes, small hands and feet, an elongated head, poor muscle tone, and sleep abnormalities. As a common side effect of Prader-Willi syndrome, she is at high risk for continuing to be obese throughout her life, getting diabetes, and having heart conditions when she's older. This child's occupational performance is impacted by Prader-Willi syndrome by having difficulty with self-feeding skills due to poor fine motor control and strength in her hands and upper extremities. Dressing is also difficult due to poor motor planning and core strength. She may have difficulty with following the directions and the sequencing steps for getting dressed. Children with Prader-Willi syndrome are typically strong, as is seen in this case study, with good visual spatial skills. She's good with puzzles and figuring out problems. She also has good visual memory, which is helpful for when she begins school. She will be able to participate in the classroom activities. One of her favorite activities is jigsaw puzzles. However, she must have larger pieces due to her fine motor control and grasp. A few examples of underlying factors and characteristics with this case study include proper nutrition. She needs weight management, decreased risk for choking as she is educated on appropriate bite sizes and slowing down when she's eating, appropriate portion sizes, and decrease the risk of obesity with the use of exercise and proper diet. She will need help for fine motor control because she needs that for all self-care tasks and to engage in her play and leisure activities. She will struggle with these because of her poor muscle strength and coordination. And another factor is sleep hygiene. Children with Prader-Willi syndrome often have difficulty with sleep, and it affects all the areas of her life. A common factor that will affect sleep hygiene is her weight, as it may cause sleep apnea due to having extra weight on the chest when sleeping. Another method for increasing sleep hygiene is having good bedtime routines, not eating immediately before bed, and a sleeping environment that is quiet and calm to help with the quality of sleep. For engagement in occupational therapy, there are many different frames of references that can be used when treating clients with Prader-Willi syndrome. The two best frames of reference are behavioral and rehabilitative. Behavioral frame of reference is used to modify behaviors such as overeating and nutritional intake. When using the behavioral frame of reference, it is important to reward good behaviors and teach the child techniques to change the underlying behaviors. This may include the use of food diaries and scheduling times for eating, emphasizing good nutritional choices when eating rather than eating everything that's in the house, and teaching the client about exercise within their physical limits so that way they are better able to manage their weight and be accountable for their actions. The rehabilitative frame of reference is used to make modifications in the environment, which can be used to compensate for poor fine motor skills and muscle strength deficits. This may include the use of specialized eating utensils such as built-up handles or weighted utensils. It may also include different types of seating to ensure good posture while being able to complete the self-feeding task independently.